We'll start shortly.
Order. Dame Priti Patel to move the motion.
I beg to move that this House has considered health and wellbeing services in Essex. I'm grateful, Mr Henderson, for you to be chairing this debate. And I'm really pleased to see that my right honourable friend, the member for Pendle, is the Minister responding. And he's been very, very good on many issues that I have taken to him thus far. Mr Henderson, I will be covering a wide and diverse range of health-related issues affecting my constituents and those across Essex, and appreciate that some of these issues will fall outside of the Minister's portfolio, but I know that he will take them on board and obviously feed back to other colleagues. He's an excellent Minister, and I know he will respond in a helpful way. And I'm particularly pleased to welcome to this debate the right honourable colleagues from my neighbouring constituencies, in particular from Malden and from Colchester, because we care about the provision and the quality of health and wellbeing services. It's important to our constituents, and Mr Henderson, I think it's important that our constituents know that we will work together as neighbouring MPs on some of these issues. As the Minister and colleagues will be aware, just over a year ago, it was March 2023, I think we were in this very chamber having a similar debate with a similar title. I think we stretched it to the east of England last time round, and this debate follows on very much from that one. Everyone here will know that Essex is an amazing county. Our residents, businesses and communities are hardworking, resilient, entrepreneurial. They're ambitious, aspirational. They obviously back all the Conservative values around lower taxes and as being a county of entrepreneur and the engine of economic growth. We are net contributors to the Exchequer, Mr Henderson, and I never tire from saying that, because as net contributors to the Exchequer, we in Essex do not always get our pound of flesh back from the Exchequer when it comes to the investment in our public services. So I think it's fair to say our constituents expect that from the Exchequer, particularly that we are supported when it comes to our public services, including the NHS, but also wider health and wellbeing services that do not always require medical interventions or diagnostics. Part of our county, and I think it's fair to say, in mid-Essex in particular, has experienced considerable levels of growth in the population and demographic changes. And that does cover the constituencies of Colchester and Malden. And just for clarification, we share district boundaries, so our council boundaries are intertwined. We are effectively 3 integrated MPs, I think it's fair to say, on so many of the issues that we stand up and speak for. But those living within Essex County Council's boundary now total more than 1.5 million, and that was at the 2021 census. That's up by more than 100,000 people on the 2011 census, which is more than 7% and above England's average. And England's average at the time was 6.6%. That includes areas such as Southend, Thurrock. So when we include those areas, our county population totals just under 2 million, actually, at 1.9 million. So we're one of the fastest growing counties in the country. Growth in the city of Colchester, which covers parts of my constituency, continues to grow. And with that, of course, demand on public services continues to grow. And we are seeing as well that under that census, we have over 300,000 people now aged 65 or over. That's 21% of our population. That's higher than the average in England. The average in England is 18.6%. And by 2035, that number will grow by up to 27%. So that is just under 400,000 people in Essex. While those aged over 85 will rise by 60%. So you can see, Mr Henderson, our numbers are growing. we are also an ageing, not just county, but country. And that obviously, by contrast, impacts on the working age populations, that's 18 to 65, which is set to rise by only 4%. So you can see the counter-cyclical issues that we are seeing here, resulting in the fact that a greater part of our population will be elderly. And with that ageing population, you know, we are, interestingly enough, seeing increasing numbers of young families coming to Essex. That means more house building. Our schools are good where we are. They're good and outstanding. And we're all commutable territory as well. Our towns are thriving and growing. So as I debated last year, we've got pressures on social care, which effectively have a very significant impact around health and social care systems, the integrated care systems that have been introduced. We've got further integration taking place. But in particular, when it comes to spending at county level and district level and city council level as well. We have a number of ICBs that cover Essex, NHS Hertfordshire and West Essex, NHS Mid and South Essex, which predominantly covers the Mid-Essex part. Then we have Suffolk and North East Essex covering Colchester and Tendring, and a number of hospitals as well. The biggest are Broomfield, Colchester, the Princess Alexandra, Basildon and Southend. And our emergency services are the East of England Ambulance Service Trust, and we have the Essex Partnership University NHS Foundation Trust, which provides mental health services, and I'm going to come on to those areas and those trusts in particular shortly. So, as you can see, we have a range of trusts, hospitals, challenges. It's fair to say when I was first elected, we had the old-fashioned PCTs and strategic health authorities. They were deeply unpopular, they were hugely problematic, they were massively resource-intensive and hugely bureaucratic. So the changes and structures we have now seen provide greater integration. But really what matters to all our constituents and residents across Essex is not so much the configuration and structures, but it's how these services work together effectively to deliver what they and their families need. So that's primary care, appointments, access to health services. So there is, I will absolutely give way.
Obviously, the debate is very clearly about health services in Essex, so therefore it's not to do with Strangford. But just to support the Honourable Lady and add my support to what she's trying, she's outlined the problems that there are in Essex, and I have to say that they're replicated across my constituency as well, whether it be the closure of the minor injuries unit, which is integral for the local community. Constituents have to travel further to get their health care, the very things the Right Honourable Lady is referring to. So does the Right Honourable Lady agree that health bodies must be focusing more on community health and well-being to ensure that all constituents have the local access they deserve to efficient health and care services? And again, I commend her.
Oh, I thank
Dame Priti Patel.
He's absolutely right. And if I may say so, Mr. Henderson, my honourable friend actually has teed up the issue that I want to discuss and raise, because it is about community healthcare provision and localised services. While I've just mentioned our big hospitals, it is absolutely vital that we have localised healthcare provision, which brings me on to a local issue that affects my right honourable friend, the member for Malden, and myself, which is the issue of the future of St Peter's Hospital, which I raised in the House last week at Health Questions, and my right honourable friend, the member for Malden, has also secured an adjournment debate for further discussion in this area on Thursday. Last night, I attended a public meeting hosted and organised in Witham Town by Witham Town Council, and I know colleagues will say more about this during the debate, but to put this issue into context, my right honourable friend and I are receiving, to say hefty mailbags is an understatement, unprecedented levels of correspondence and communications, emails and phone calls, from both concerned and angry residents who are frustrated by the plans put forward by the Integrated Care Board to remove services from St Peter's Hospital that could, and effectively the consultation that has been proposed, could lead to the closure of the hospital. The Minister will know these plans are subject to consultation, and my right honourable friend, the member for Malden, and I are actually calling for that consultation to be extended, and it has been extended. We were given that clarification yesterday. But the services that we are discussing include the removal of stroke rehabilitation in patient beds to Brentford and Romford. These are not local areas at all. These require considerable travel, making permanent the temporary removal of a midwife-led birthing unit, and seeking the views of the future removal of other services from the site, which include outpatient services covering blood tests, ultrasound scans, x-rays, podiatry clinics, and the services to support mental health patients, totaling on average around 300 patients a day using this particular site. I should add, this site is a much-loved community site, and I think it's fair to say, generationally as well, everyone within our districts would have been touched with some kind of interaction and engagement. I myself have been a user of St Peter's, the maternity facilities, and if I may, I met the maternity nurses there last night who kindly came to our public debate. They are remarkable ladies, and they're just wonderful in the care and compassion that they give. Mothers, and new mothers in particular, who quite frankly do struggle, you know, after the birth of their first child, to adapt to some of the post-maternity services, and these nurses are wonderful. The hospital serves the town of Malden, but actually the wider rural area, and including constituents in Malden district that come under the Witham constituency as well. And what's more is that this part of Essex has experienced very, very considerable economic growth, and by that I mean housing growth in particular. We have, both our constituents, the Right Honourable Member for Malden and I, we can't even speak about small housing developments. We have significant housing developments, and I'm just going to refer to Westcombe Park development in Heybridge, which straddles both our constituencies. That's a development of over 1,000 homes. And that really speaks about the type of developments that we have locally. The current local plan is running up to 2029, and we will see the development of another 5,000 homes. And recognising that we need more homes, people need homes to live in, we aspire to own our homes, we need to know that new housing and population growth will actually have the infrastructure and public services that will support that in the long run. So this consultation for St Peter's is very important. The document itself covers a range of issues, but I have to say that it's not acceptable for us now to just say it's fine for the services to go elsewhere and be relocated. Our constituents will experience considerable travel times, and there are issues with local public transport as well. I'm afraid to say trying to park a car at Broomfield Hospital is now impossible. So we want to see these services remain locally. I think that's absolutely pivotal. Importantly, within the town of Malden district itself, our constituents have serious reservations about these proposals, and I think it's right that we, as local MPs, continue to support and champion and work with the Integrated Care Board and the local authorities and with ministers and the government to secure these services in Malden town itself. We have to keep these services in our district. So I know the Minister can't specifically intervene around matters being considered by the ICB, but I would welcome his views, and I think this is going to be very important going forward. I think this consultation also sets a benchmark in terms of engagement with ICBs and future-proofing localised healthcare services, which we all want to see across our constituencies. I've mentioned enhancing the services and safeguarding services in Malden itself and the Malden district. The department is very familiar with communication around Witham Town and my calls over 14 years for a new health centre in Witham Town. My correspondence file is large in the department, I know that, and I thank the forbearance of ministers for all the responses that they've sent me. But like Malden, Witham itself has had huge amounts of growth in housing, which means that the demand on primary care is outstripping supply. We have 4 GP practices in the town itself. I'm going to name them all. Fernhouse Surgery has 16,500 patients. Douglas Grove Surgery, 6,500. Witham Practice, 6,500. Collingwood Practice, which I visited recently, 2,500. That's a patient list of around 32,000, just in the town itself. The national patient GP ratio average is around 1,700 patients per GP, but across these 4 surgeries, there are around 13 full-time equivalent GPs, basically meaning that the patient GP ratio is close to 2,500. That is the tenth situation that we have and the challenges we have. recognising as well we have the incredible Anglia Ruskin Medical facility. Many of us were part of the business case for that, and we're very proud of that. September last year was the first cohort of medical practitioners that came out of them. We're desperate to make sure that we keep them all local. We absolutely want them local. But the reality is we should just discuss the practicalities of how hard it is to get a GP appointment. So with that, of course, that's why we need new facilities, more support for GPs, more primary care staff to improve health services in Whittam. I'm consistent in my campaign for that. I'd like to pay tribute to Braintree District Council, who've been on this journey with us. We do have capital funding for a service, but the Minister will recognise that we need the GP practices to come together, in particular to put the business case as to how they can all work together. I do want to pay tribute to the work of the local ICB and the Alliance Director for Mid-Essex, Dan Doherty, who has undertaken to pursue this project with local councillors. And I have to say, I feel for the first time in a decade, we have better collaboration and a stronger commitment to making this happen. We have opportunities to redevelop locations. I can't speak about those locations. Some are commercially sensitive and they're subject to local councils and the ICB right now working together. But we do need the critical mass of our GPs to firmly commit to driving this proposal forward. The Minister will know it can't be achieved without them. And we want to ensure that, there is sustainability for them and a future business for them where we are protecting, for example, prescribing, because one of these practices it's a prescribing pharmacy, so it's important that we give them the approach to do this. I have to say, with the whole game-changing dialogue that we see in government now about localised health services, community pharmacies, the Chancellor's focus on improving efficiency in the NHS, if we can pull these strands together and knit them together, this could develop and lead to great outcomes, I believe, for Whittam Town. The frustration of my constituents in Whittam Town is palpable. They've been waiting decades for this. We must, as a government, deliver for them, and I will continue to press the government on this. In addition to the growing demands in Whittam, we have the growing demand for primary care and GP services in other parts of my constituency. I'm going to name them. These are theoretically villages, but the growth basically means that they do not fit the old analogy of what a village used to look like. Villages such as Kelvedon and Fearing, Stanway in its own right is no longer a village. It is now becoming a town within the Colchester city footprint. And the beautiful village of Tiptree, which is pretty famous for Wilkin & Sons and some wonderful businesses as well. The Tiptree Medical Centre now has 12,000 patients on its books, and there are concerns that there are too many for one practice to handle. In recent days, I have received a letter from the practice explaining that their clinical rooms are full to capacity and that they may be considering options to close their patient list or new patients, to new patients, either on a formal or informal basis, and to significantly reduce their patient catchment area, so not to include patients who are registered in the CM postcode area. This is worrying, if I may say so, and it is deeply concerning. Action is needed to address the concerns about the impact of population growth. This is, of course, something our local authorities should be doing as they develop their local plans and be much more strategic. But 6 years ago, a very unpopular planning application was submitted for 200 dwellings in Tiptree, which was widely opposed, including on the basis of pressures on the local health services, on Tiptree medical practice in particular. The application did, however, initially put land aside for a new medical facility. Despite local opposition, the application was granted on appeal. However, no site for a medical facility was included in the end, as according to the decision issued. And that decision issued said that the application originally included the provision for land for a medical facility, but this was removed from the proposal. This is because Tiptree Medical Centre and North East Essex Clinical Commissioning Group, the CCG, no longer required the land on the site and instead requested a financial contribution towards the provision of medical facilities. This contribution has been incorporated into the 106 agreement. But as we can see from the correspondence that I've referred to from the medical practice, The new capacity is now not sufficient. So what we now have in Tiptree is an unwelcome development, a growing population, but no significant new investment to meet the demands. And again, across Essex, planning contributions to health facilities are just inadequate, and they are not delivering on the improvements that have been promised. This is totally unsustainable. I would like the Minister to review this and the Department to review this, and in particular look into the provision of GP services in Tiptree and with the CCG to look at how developer contributions are secured and issued. Now, as well as protecting and enhancing primary care facilities, of course, we do need to talk about the issue of GP training. I've already mentioned Anglia Ruskin University, and, you know, we are thrilled with this facility that we have. And I know the Minister himself, I think the Minister may have visited recently, and, you know, I'll be heading there as well this week. It's an incredible facility, and we do need to grow that facility at some stage, which basically I'm hinting already to the Minister, that means expansion of the facility, and then we can grow capacity and have more locally trained medical practitioners. But on the subject of healthcare in our community, I do want to thank the Minister and the government for empowering pharmacies to deliver more services. This is long overdue. I've raised this in previous debates and spoke when we had the announcement in January that pharmacies can now support patients with some common conditions. This reportedly frees up something like 10 million GP appointments per year. That's incredible, while providing pharmacies with new business activities, and importantly keeps that footfall going, because our local pharmacies are at the heart of our communities. And I think it's fair to say for all honourable and right honourable members in this debate today, knowing our geography as I do, and we all do, particularly with the right honourable member from Alden, where we touch the coast, this is absolutely pivotal, it really is. So I would urge the Minister to look to consider empowering pharmacies by giving them the opportunity to grow that provision around the wider conditions that they can treat. I'm a great believer in social prescribing as well, and some of these pharmacies could utilise their own buildings to even have social prescribing hubs as well, which I think is something that we should all collectively expand and look at too. So the Minister's heard me touch on about the importance of investment in primary care services, but he will also recognise from the statistics that I referred to in my opening remarks, the importance of prevention and social care services. Essex County Council, I have to say, I think we're blessed with the calibre of leadership that we have there. We have the County Council led by Kevin Bentley and County Councillor Sir John Spence, the portfolio holder for health, adult social care and ICS integration, have got a strong record in supporting investment and service area improvements. I don't say that too lightly because we weren't there a decade ago. And with that, the infamous term that we none of us like to raise and say of bed blocking would take place in our hospitals, and of course we know the implications of all of that. But at any one time, the council is supporting around 16,000 people with social care and 40,000 during the course of the year. Over 90% of people who use their services say that they are safe and secure. The council is supporting an increase in numbers with hospital discharges and re-enablement services. And I visited actually an organisation called MediEquip on Friday, based in Braintree District, that are contracted by Essex County Council. And the innovation and the quality of care and equipment that they are providing with re-enablement services is phenomenal. And I think we have to do much more to support this. We really do. The Essex Wellbeing Service has helped 73% of people in Essex to quit smoking, for example. So, you know, these are important interventions because it's preventative care. And also it supported the provision of 42,000 NHS health checks. We need to do much more on the health checks, and in particular around cancer and cancer checks as well. I won't go on the numbers that I mentioned earlier on around the elderly population, but the population also with learning disabilities and autism is also increasing. It's expected to grow by 3% by 2025. That's just around the corner, that's next year. And the population with working-aged adults with sensory impairments will grow by 5%. The council is spending around £500 million a year on adult social care services and around just over 200 million on people aged over 65. and just under 300 million on working age adults. So again, that's age between 18 and 64. I welcome the funding that we have, but we definitely need to have much more. And with that, I know I met parents yesterday while in the constituency who are fighting for education, health and care plans, which is common for all of us now. Very difficult areas. Since 2019, under Essex County Council, the numbers have increased from just under 9,000 to over 11,600 in 2023. That's a 29% increase in 4 years. Essex is doing very well in this compared to many authorities, but I have to say we are struggling to get these plans for children, and it is a ongoing, long-standing issue. And I think the Minister will recognise that we're seeing greater demand from parents, and schools themselves are raising this issue. Another area of frontline health provision, which will be familiar to the Minister, is dentistry. And in the east of England in particular, this isn't just Essex, we have long-standing problems, and the House of Commons Library has shown in Essex that in 2023, around 52.2% of children in Essex has seen a dentist in the last 2 years, and that's just under the English average of 53%. Our figures are not good, and we need to know, and I'd like to hear from the Minister, how we're going to tackle progress in this particular area. I would like to just touch on the mental health statutory inquiry and thank the Minister for the time he gave us last week to meet to discuss this, and colleagues in Essex are familiar with the concerns over this whole issue. When we were debating health and wellbeing services last year, the inquiry was on a non-statutory footing, and it was established back in 2021 to investigate 2,000 inpatient deaths that had occurred since 2000. I want to pay tribute to Geraldine Strathsey for her work in chairing that inquiry and for doing all she could to see the evidence and the witnesses that participated in that work. She, families and colleagues in this place were frustrated that not enough progress was being made, and importantly, not enough evidence was coming forward. Colleagues here, all colleagues, pressed for the inquiry to be converted to a statutory inquiry. And we now have Baroness Kate Lampard to chair that inquiry. Over the last few months, she's been consulting on the terms of reference, and I want to thank Kate for that work that she is doing. Obviously, the Minister is familiar. We're waiting for the terms of reference to be finalised. Our constituents, I have to say, have been incredible in their dignity, their courage and bravery, but also their resilience. As human beings, they have been through a terrible ordeal. They really have. They want to see the statutory inquiry now progress at pace. I just want to pay tribute to my constituent, Melanie Leahy, whose son Matthew died in 2012 while as a patient in the Linden Centres. She is the lady, if I may say so, and my right honourable friend, the member for Malden, will speak to this as well, as she was at one stage his constituent too. Remarkable for, I think, the way in which she is absolutely tackled what I call publicly institutional state failure in terms of how her son was treated, but importantly helping to get a statutory inquiry, and I pay tribute to her. They must all get the answers that they need and lessons learned from what is happening, and we owe it to those lives that have been lost and their families to work to absolutely change the system, but for them to get answers. And I look forward to the Minister's comments, particularly in this area, and how we will come together to make time to meet some of the families as well, and work with them too. Mr. Henderson, my final comments that I just want to touch on really speak to the future of the NHS, workforce plan, growing demand in services, and just also the work that's taking place in our hospitals and NHS around recruitment. My last dialogue with the Chief Exec of Broomfield Hospital, and I'm interested in this, and I ask the questions all the time. The House has heard the numbers and the statistics I put forward, how difficult it is to get an appointment, how pressed we are on medical practitioners. I think we should also just recognise we have an incredible international workforce locally, we really do. Our NHS would be in a much harder, difficult position if it was not for the staff from Botswana, India, Pakistan, Nigeria, Nepal, Sudan, India and Egypt. that are working in our health and social care services and contributing to our public services, our economy, and to our tax system. They are caring for elderly and vulnerable residents across our constituencies, and they should be thanked for doing that. There have been some interesting debates when it comes to migration and immigration, and also the skills of those coming to our country and their contributions, while, of course, the need to control numbers. But we have to recognise that is because of workforce pressures. We have not done enough ourselves as an economy and a country to do more to grow the skill sets here. I want to encourage the Minister to ensure that as part of the NHS long-term workforce plan, we do much more. We've got AIU, there are other universities across the country as well, that we absolutely do more. But what I do want to see happen from this government is the recognition that we need a wider labour market strategy which must address these issues and sometimes unnecessarily inflamed debates around immigration, but also recognise the fact that those that come to our country on a skilled worker route, they pay thousands of pounds, many of them, not just in the NHS, and if I may, just outside of the NHS, for immigration health surcharges, which actually contribute to the finances of the NHS. Many of them are high-rate taxpayers, and they contribute to our economy and to our country and to these important sectors. And with that, of course, technology has a role to play. It really does. We can do so much more through technology, and we must make sure that we can absolutely grow the workforce locally going forward. I have presented the Minister with a long list of health and wellbeing issues across Essex. I want to thank him and his team for their patience. I know the Minister he's a great considered Minister. He will respond accordingly. But I just think it's fair to say, with investment, innovation and support, our health and wellbeing services across Essex could be so much better and could improve. And importantly, they would meet the needs of our constituents and ensure that we have not just a sustained NHS service that meets the needs of our population, but also that we would have a happier and healthier population. Thank you.
The question is that this House has considered health and wellbeing services in Essex. Will Quince.
Well, thank you, Mr Henderson, and it's a pleasure to serve under your chairmanship, and I'd like to congratulate my right honourable friend, the member for Whittam, for securing this important debate on health and wellbeing services in Essex, and of course for her powerful speech, which raised a number of issues affecting all parts of Essex, including my own in North Essex and specifically Colchester. Understandably, I hope, Ms Henderson, you all understand that I plan to focus my remarks on North Essex and my own constituency, but given that I stood down as a Minister of State at the Department of Health and Social Care only in late November, I wanted to start with just some reflections on our NHS more generally. And may I say in passing, Mr Henderson, that my right honourable friend, the member my friend the member for Pendle, is doing a marvellous job in a difficult brief. As he knows, it is a privilege and an honour to be a Minister at the Department for Health and Social Care and to be part of our NHS's story, a universal, comprehensive system, free at the point of use and paid for through taxation, principles that remain intact and receive strong public and political support today. And at its heart, as my right honourable friend, the member for Whittam, set out, it's not about buildings and equipment, as important as those are. And of course, we're passionate about health centres and about hospitals and about the latest technology. What it's really about is the circa 2 million people that work in our NHS, people working day in, day out to deliver and facilitate the high quality of care to patients that we rightly expect day in, day out. And I want to take this opportunity, Mr Henderson, to thank every single one of those who works within our NHS, and especially those in North Essex and serving patients and my constituents in Colchester. Now, we all have our own personal experiences of our NHS and the care that we and indeed our families have received. And we think about the future of health and wellbeing services in Essex. We've got to be mindful of the broader context, much of which my right honourable friend set out in her powerful speech. Our NHS is under significant and considerable pressure. It faces a number of challenges. We've got increasing demand, in particular in primary care and urgent and emergency care. we're living longer, which is a brilliant thing, but it comes with challenges, including living with complex conditions and comorbidities. Social care continues to be a challenge, especially around workforce, as my right honourable friend set out. We've got an increasing demand on mental health services. The pandemic, and not just COVID and the backlog and the waiting lists, but the resulting later diagnosis of things like cardiovascular disease and other conditions, as so many people weren't able to or didn't come forward with symptoms or for regular checkups. A seemingly at times intractable complexity of NHS structures and processes, that silo mentality that sadly we see so often, multiple tiers, archaic processes, challenges rolling out the latest innovative technology, things like tech, drugs, treatment, therapies that are available in some parts of Essex but not others, in some parts of our country and not others, and making sure that research and innovation is truly embedded in every single trust in the country. Now, this isn't an exhaustive list, and I haven't mentioned two of the biggest challenges, one of which my right honourable friend touched on in some detail, but I will touch on the workforce and funding. Now, I'll touch on funding first, as the NHS is always going to need increased funding to reflect the changing nature of medicine, the health needs of our population, and importantly, to ensure that we have the very latest and most innovative and cutting-edge medtech, treatments, drugs, procedures, and therapies for our patients. And despite record revenue and capital budgets for our NHS, year-on-year real terms increases in funding and further significant funding, in fact, several £billion announced in the spring budget, which I massively welcome, I do recognise that budgets remain a challenge for local systems and indeed for trusts, not just in Essex, but across the country. The second is workforce, and this is absolutely vital, as my right honourable friend pointed out, and she was absolutely right to raise the important, in fact, hugely important contribution that international staff make to our NHS. They have since its formation and continue to do so. And I think, regardless of the NHS long-term workforce plan, as important as it is, international will still have a hugely important role, international recruitment will still have a hugely important role to play. I know, I was there at the time, but my right honourable friend will no doubt elaborate on this. The government commissioned NHS England to produce the first ever NHS long-term workforce plan, which the government then was published and the government backs with £2.4 billion over the next 5 years. So things like doubling medical school places, including ARU, which we're so incredibly proud of. Huge increases in nursing, in midwifery, in allied health professional training places, and a plan, and this is the critical, it's not just about recruitment, it's all about retention too, and of course reform alongside that. But the truth is, we talk about workforce and we talk about funding, but those two alone will not tackle the challenges that our NHS faces either nationally or indeed locally. And it is only by innovating and transforming local systems and the delivery of health and care provision at a local level that we can deliver on what I think we all across this House aspire to, which is our local populations living longer, healthier, happier, fulfilling lives. And I firmly believe, and my right honourable friend touched on this, that integrated care systems are at the heart of achieving this. They're working at a local level, holistically, to get systems focusing relentlessly on patient outcomes and patient experiences, and breaking down that silo mentality that sadly we have so often seen within our NHS historically. And the other critical role that they have is driving transformation and innovation at a local level, getting trusts and organisations to work together and using all assets and capacity within health systems. And I want to pay tribute, as my right honourable friend has done, to the leadership of Suffolk and North East Essex Integrated Care System, Dr. Ed Garrett, and his team. And I know how closely they work with Nick Hume and his team at East Suffolk and North Essex NHS Foundation Trust, or as it will be known locally, Colchester and Ipswich hospitals. Our health system more broadly, and indeed our two acute hospital trusts in North Essex and East Suffolk, face many of the challenges that I set out earlier. But to their great credit, they are continuously looking at innovative ways to address them. Our system, for example, in North Essex and East Suffolk, is consistently one of the highest and best performing systems in the country. They have the fastest rollout of the COVID-19 vaccine. They're a top performer for diabetes care. They have consistent low levels of delayed discharge, an issue that I know my right honourable friend, the member for Pendle, and indeed his fellow minister, a member for Fareham, spends a lot of time focusing on, and rightly so, because of the continued pressure on urgent emergency care and the importance of tackling delayed discharge. They've led on innovation. They've developed the Care Tech Campus and the Challenge Fund, in particular with the University of Essex and Essex County Council. And my right honourable friend, the member for Witham, was right to praise the role that Councillor Kevin Bentley and Councillor John Spence have played in that, working in partnership with the health system to deliver the innovation in care, which is providing not just better outcomes, but better experience for patients. And they're leading the way on NIHR-funded research, which we want more trusts across the country to do. But I just want to, before I finish, just raise a handful of initiatives that I think deserve highlighting, because they are going to be transformational in terms of both patient experience and outcome in North Essex and East Suffolk. The first is the Elective Orthopaedic Centre at Colchester Hospital, which I was fortunate enough to have a tour of recently. Hugely exciting. It's an impressive £64 million facility serving North East Essex and East Suffolk. It's the largest of its kind in Europe at over 11,000 square metres. What will that include? 8 theatres, 3 wards, a physio gym, day surgery and recovery centre, and its own imaging department. And importantly, and I know my right honourable friend will be pleased to hear this, it will enable 10,000 procedures a year following its opening, which is due to take place in August of this year. Secondly, and I'm sorry my honourable friend, the member for Clacton, couldn't be here to hear this, but I do want to reference something in his constituency because it serves the wider area. The Clacton Diagnostic Centre, a £25 million investment in the state-of-the-art diagnostic centre, which means patients can access the full range of diagnostic services, including CT scans, MRI scans, X-ray, ultrasounds, blood scans, and cardio-respiratory. And importantly, and I visited a lot of community diagnostic centres in my time when I was in my right honourable friend's role, this facility has delivered over 110,000 treatments in the past year. And I'd love my right honourable friend to check, but I think that must be one of the highest performing, if not the highest performing in the country. I want to just turn to 2 mental health and mental resilience projects which our integrated care system is leading on, which I think deserve a mention. The first is the North East Essex Mental Health Joint Response Vehicle. And this was following a successful pilot between January and March in 2023. The Mental Health Joint Response Vehicle was successfully commissioned for a 3-year service. And this unique service is a collaboration between the East of England Ambulance Service and Essex Partnership University Trust, which is our mental health trust, with a paramedic and mental health practitioner manning a 10-hour service 7 days a week. And that service has been so successful in ensuring that those experiencing a mental health crisis are seen by the most appropriate service. And I'm really keen that we extend those hours, and I know that the ICS are looking at securing additional funding to do so. And the data backs up why I think it is a good thing to do. In 2023, that joint response vehicle attended 757 patient calls for a variety of mental health related presentations, including suicidal threat, self-harm, depression, psychosis, with 77% of patients being redirected to another service or provided with a care plan and a care plan at home, reducing the number of attendances at emergency departments for mental health related issues by 55%. And I won't need to remind my right honourable friend that mental health is not just one of the largest drivers of attendance, especially conveyance via ambulance, at our emergency departments, but it leads to some of the longest stays in terms of cubicle occupation in our emergency departments because they don't have the beds within hospitals to move people up and into, often taking additional resource with police officers and others. Second I want to touch on is more around mental resilience, but I think that it's an important area to just highlight. This is primary school wellbeing hubs, and as a former schools minister and children's minister, where we did worked very closely with the Department for Health and Social Care around investment in mental health resilience support with mental health support teams and training for schools, and the support teams that would actually go into schools to provide support. The Tendering and Colchester Wellbeing Hub, it's a pilot project with 22 primary schools in Colchester and Tendering, and the project aims to improve children's mental health and well-being through prevention and an early intervention approach. And this programme's delivered across 22 schools, with 19 of them completing a number of questionnaires that have been evaluated by the University of Essex to demonstrate the impact and evaluate the programme over the 12 months in which it ran. Overall, pupils who attended the Wellbeing Hub sessions had significant increases in their levels of resilience, well-being, happiness and decreased anxiety. And it was supported by over 80% of parents who said their children communicated better, while over 60% said that they had more confidence, are more resilient and are less stressed or anxious. And I think they are programmes which I know are happening to varying degrees across the country, but I think our integrated care system is really leading the way, and they are demonstrating areas in which they could be replicated and rolled out to other parts of the country. In conclusion, Mr Henderson, let me thank again all those involved in the delivery of healthcare across North Essex and the leadership at Suffolk and North East Essex Integrated Care System and East Suffolk and North Essex Foundation Trust for driving that innovation and transformation of health and care provision locally, which we know is the future to delivering not just better patient experience but better patient outcomes. And I want to again thank my right honourable friend, the member for Witham, for giving us the opportunity today to talk about health and wellbeing services in Essex, something, as she rightly said, we all care so passionately about. We all know that the challenges both locally and nationally are significant. We all want and expect world-class care for our constituents, and I know that I and indeed all of my Essex colleagues will continue to work with our local NHS in all its guises to support them to deliver it.
So John Whittingdale.
Thank you, Mr Henderson. And can I start by thanking my right honourable friend, the member for Witham, for obtaining this debate. As she said, we representing the County of Essex do work together very closely on these matters. And I absolutely endorse everything that she said, and indeed my right friend, the member for Colchester. I was actually elected originally for a constituency called South Colchester and Malden. It included the areas of the Malden district, which my right friend for Witham now represents, and indeed a number of wards within the Colchester constituency. And during all the time that I represented that area, we have been debating the problems of healthcare within the county, and in particular, the lack of funding. When I first came here, we were part of something called the North East Thames Regional Health Authority. And the funding which went in, and my right friend's absolutely right, the record of funding of the NHS overall has been very good, but we have consistently suffered from a skew, with more money going in originally to the areas of London, which were part of the North East Thames RHA, and subsequently, through the various allocation formulas, we have lost out. And actually, the funding per head has consistently been below, and that is reflected in some of the problems that we have, particularly because at the same time that we have been underfunded, we have seen steady population growth, and that is continuing. And my right friend referred to the 1,000+ houses being built in Heybridge, part of which fall within my constituency. I've got another development the other side from Heybridge in Malden of another 1,500 houses. There is something like 3,000 houses going up in Malden and Heybridge alone, with more houses across the district. They are putting steadily increasing pressure on the health service. The issue which my right friend referred to of St Peter's Hospital is one which is of huge importance to the residents of the town, of the Malden district and the surrounding area. And I will be bringing this matter to the attention of the House on Thursday on an adjournment debate, and so we'll have a lot more to say about it. But it is fair to say, in summary, St Peter's Hospital is 150 years old. It has been steadily deteriorating, and in all the time I've been representing the area, we have been debating a replacement, and we've come very close a number of times, but each time it's never quite happened, and it's now reached the point where that hospital is no longer able to safely provide services in some of the areas because the original structure was not relevant, and although money has been spent on it, nevertheless it has deteriorated, and we have been debating whether or not to refurbish it or to relocate it for all these years, but nothing has happened until we've reached this point where it is now proposed to close it and remove services to other locations, particularly maternity and inpatient services, to areas which are far from my constituency, in particular some of the more remote areas. And that is something which I'm going to speak about in more detail on Thursday. But it is an indicator of the way in which I think that particularly my part of Essex has been underprovided for far too long. And that is also reflected in the issue which my friend talked about, which is access to primary care. We have 2 GP practices in Malden. They both have patient lists well in excess of 12,000. I mean, and I know that across the country people struggle to get appointments, and we all hear about the difficulty people have in ringing at 8:05 and being told that they've all gone. But it is especially acute in Malden. Both those practices are in facilities, in buildings which are simply not fit for purpose. And that is compounding the problem. And in each case, we are looking to try and reap a benefit from this housing development in terms of obtaining investment into infrastructure. And I do share my right friend's view that those currently trying to supply health services across the county are doing their best, and I absolutely join in congratulating and thanking the leadership of Essex County Council, who I met last week to discuss some of these problems, Kevin Bentley and his colleagues, and equally the representatives of the ICB. But we have reached a point where action has to be taken, and we are going to be looking for help to government. And as I say, I will be talking more about that on Thursday. But I know that every MP in this in the House of Commons will be claiming that their area needs more support, but I do think that actually ours is the consequence of decades of underfunding, and we have been shouting loud for too long without being heard, and we have reached a point where something has now to change. I do just want to touch also on the issue raised by my right friend, which is the Essex Mental Health Inquiry, now called the Lampard Inquiry. Again, originally my constituent, Melanie Leahy, now a constituent of my right friend for Whittam, also my constituent, Lisa Morris, have been calling attention, ringing alarm bells about what has been going on in mental health care in Essex for a long time. When they first started doing so, they asked for an inquiry, and for a long time they were denied it, until eventually we recognised that clearly something was badly wrong. The number of deaths taking place under the care of the then Mental Health Trust was excessive and could not and needed examination. The government eventually agreed and did set up an inquiry, but it wasn't statutory, and they again came back and said it has to be statutory. We at the time said to them that we discussed with the then ministers, who said, no, there are advantages in it not being statutory, and therefore we shouldn't go down that road. Now the government has accepted, but it does have to be made a statutory inquiry. And at last, a proper examination can take place to identify exactly what has been going on. But there is still concerns being expressed by the campaigners who have lost family members, and I absolutely welcome the meeting which I had with my right friends, with the Right Honourable, my right friend, the member for Pendle, just a week ago to discuss how to proceed with the inquiry. There are real concerns over the timescale which is being examined and whether or not it can continue to examine deaths which are still taking place. Even very recently, there has been a death. Equally, there is the concern about the lawyers who have been working pro bono on this, Hodge, Jones and Allen, and they do need some kind of remuneration if they're to continue to do so. Other inquiries, the lawyers representing family members have received interim payments. I think the lawyers in this particular case also need some support, and I would ask my right friend to consider that. But most important of all, they have been promised meetings, and I know that my right friend is in the process of setting those meetings up, both with the Secretary of State in order that she can hear directly from some of the families that have been affected, and that he also is looking at this issue around the terms of reference and the process under which the inquiry proceeds. But this has been going on a very long time. And he will understand the frustration that exists. And so anything that he can say this afternoon about whether or not we can now press ahead, have those meetings with the families and those representing them, and to get a proper, full examination of what has happened in the Essex Partnership, University, NHS Trust, and its predecessor bodies, we would be extremely grateful to hear. Mr. Henderson, as I say, I will be returning some of these themes on Thursday, but once again I'd like to thank my right friend. We will continue to work together with my right friend from Colchester and across the county to ensure that our constituents receive the proper health care which they deserve.
Opposition spokesperson.
Thank you, Mr. Edson. It's a pleasure to serve you as chair. I want to start by thanking the Right Honourable Member for Witham for securing this important debate. I know this is something she's passionate about. She's highlighted a number of important issues and concerns regarding health and wellbeing services in her constituency and across Essex, and I'm pleased to be able to respond as part of the opposition today. I also want to thank other honourable members for their contribution to the debate as well. I found it very insightful. I'd like to start with GPs. As we know, that securing the future of general practice is integral to the future of the NHS as a whole. GPs are vital to their communities and contribute hugely to keeping the nation healthy. Yet, I have to say, the government has broken its promise to recruit more than 6,000 more GPs in the last 5 years. Ultimately, the NHS has lost the equivalent of 1,830 full-time, fully qualified GPs since 2015. And there are GP shortage crises, and Essex is unfortunately on the front line of this. I also, when you look at the numbers, if you break it down, of patients per GP in the UK, Mid and South Essex ICB is worse than anywhere else in the country. Do not dispute that. So there is one GP for every 2,281 patients. Staff shortages are a vicious cycle that leads to worsening outcomes, and we must train thousands more GPs to finally end this cycle. If we don't, we risk allowing the health of our nation, the health of the people of Essex, to only just get worse and worse. It's also worrying when you see the CQC warn Mid and South Essex NHS Trust last summer over failings of 3 Essex hospitals. They found medical care had deteriorated, with waiting times not meeting national standards and patients not assessing the needs services when they needed it. And the people of Essex do deserve the care. They deserve to be seen on time and have local hospitals providing quality of care for them when they need it most. In recent years, elective waiting lists have risen sharply in every region and area of England, but there are large geographical differences, with the east of England being one of the worst affected. So when you look at the figures and compare it with January 2020, the waiting list at the end of the last year was 113% higher in the east of England. At the start of last year, the Prime Minister made a promise to the country to get the NHS waiting list down. Last month, he admitted the obvious, that he had failed. However, the reality is the government have failed in achieving most of the waiting lists and waiting time targets since 2010. And unfortunately, this is a result of 14 years of successive Conservative governments running the NHS. I also quickly wanted to reflect on the worrying state of maternal health services in Essex. We do face crisis in maternity services across the country, with the CQC rating 2 out of 3 maternity units dangerously substandard, and of the people of Essex, all but 1 maternity hospital unit is failing. Following the release of the final Ockenden report nearly 2 years ago, I urge the Minister to respond today on the Government's progress towards implementing these reports' immediate and essential actions in trusts across the country. Safe care for women, babies and their families must be the top priority for our Government, and it's clear that more needs to be done to improve care and safety in maternity services in England. Firstly, I want to speak on the Essex mental health inquiry. This has been covered in this debate as well. I also want to put on record that I want to also praise the grieving families and hard-working campaigners in their efforts to secure a statutory inquiry. In particular, I want to honour Melanie Leahy, whose son Matthew died more than 10 years ago in a mental health unit in Essex. She has never given up the hope of fighting justice and fighting to improve mental health provision in Essex across the country. And I say she's an inspiration to us all. Labour welcomed the announcement at that time, and I hope to hear an update from the Government today about the progress of the Lampard inquiry. The Secretary of State offered to meet with families last year, but this has yet to happen. And The Guardian has reported today that bereaved families have accused the Minister of dragging their feet over the inquiry into the death of almost 2,000 patients across NHS mental health trusts in Essex. So I hope to hear from the Minister today about when the meeting is scheduled to take place, when the inquiry's terms of reference are scheduled to be published. I really want to urge the Government to do all they can to make sure that this inquiry finally provides the answers for the bereaved families that have been waiting for far, far too long. But while we are most determined to find answers in the Pacific inquiry, we must be clear that poor mental health services and standards are worryingly prevalent across other parts of the country. We continue to hear of other tragedies in mental health services. These are unacceptable. The Government must treat these incidences as a wake-up call and act in light of the soaring number of investigations to prevent any further suffering or loss of life. In recent years, one of the ways this Government could have acted would have been delivering a reformed Mental Health Act. Reforms would have finally modernised legislation to strengthen people's rights and choices within mental health settings. This was a manifesto pledged by the Government, and the bill is ready to go, oven ready, as some on the opposite benches might have said previously. There is no excuse for this delay, but this Government has failed to get this done and deliver this much-needed changes. Labour have committed to introduce this bill in our first Kin speech, and not only will it deliver the real change to mental health services across the country, 8,500 new mental health specialists, mental health support in every school, open access mental health hubs in every community. These are fully funded and game-changing policies that will make a real difference to tackling mental health crisis we currently face. And as we've heard today, health and wellbeing services in Essex and across the country are facing really extreme challenges. And if we are privileged to get into government, the opposition are determined to make a real difference for the people of Essex, which will be delivering more GPs, more midwives, more health visitors, more mental health support, and cutting waiting lists and waiting times for people of Essex and this country. And we will deliver a mission-driven government and break out of the current doom loop. We will push decisions out to communities and finally end the short-term stick-and-plaster politics of this government. Thank you, Chair.
Minister.
Well, thank you, Mr Henderson. Can I start by saying it's a pleasure to see you in the chair. I think this is the first time I've responded to a debate whilst you've been in the chair. And it's a pleasure to respond to this debate. And can I start by congratulating my right honourable friend, the member for Witham, on securing a debate on such an important subject. My further thanks go to my esteemed predecessor, my honourable friend, the member for Colchester, not only for his work supporting his own constituency, but for his tireless efforts as a health minister and my immediate predecessor in the department. I would also like to thank my right honourable friend, the member for Malden, for his thoughtful contribution today and the powerful advocacy that he always conducts on behalf of his constituents. Mr Henderson, we all know that much of the continued recovery of the NHS following the pandemic is entirely dependent on the people who work in our NHS. So can I start by commending my honourable and right honourable friends for the tribute that they've paid to NHS staff in their remarks today. Our long-term workforce plan, which was raised by my honourable friend, the member for Colchester, sets out the government's vision and commitment to making sure we have an NHS that can deliver for the future. Our plan commits to improving retention by improving culture and leadership to ensure that up to 130,000 fewer staff will leave the NHS over the next 15 years. It also sets out an aim to double the number of medical school places in England to 15,000 places by the year 2031-32. This is our commitment to the future of the NHS moving forward, and there is cause for optimism now too. In recent months, the rate of staff leaving active service in the NHS has returned to pre-pandemic levels. In the east of England, the rate of staff leaving active service in the NHS has followed a similar pattern and is now below pre-pandemic levels. We know there is more to be done, but the plan is working. The number of doctors and nurses is also on the rise. There are almost 6,800 more doctors and over 21,500 more nurses in the NHS than last year. Within the east of England, there are almost 740 more doctors and almost 1,700 more nurses in the NHS than last year. My honourable and right honourable friends mentioned Anglia Ruskin University, and I had the huge privilege of being able to visit the university on the 4th of March to meet some of the medical students. I must say, if anything gives you optimism about the future of our NHS, it's sitting down and having a round table with some of the medical students in a university like Anglia Ruskin that has really gone from strength to strength over recent years, thanks to the campaigning of local MPs who have really championed investment into that university. Of course, medical training is, at our best medical institutions, is an essential part of delivering the long-term workforce plan. I therefore very much welcome Anglia Ruskin University's commitment to the medical degree apprenticeship and recognise that it is a trailblazer. Anglia Ruskin University can bid for additional government-funded places in common with all existing medical schools across England. I look forward to continuing to work with them and local MPs to secure more investment into that university. We know that the NHS faces pressures all over the country, including in Essex and the east of England more broadly. And we as government are committed to working every day to improve the outcomes and experiences of patients. A huge part of this is making sure that patients get to talk to a GP. I am glad to say that since 2019, we have recruited over 36,000 additional staff into general practice, covering a range of roles, including pharmacists. We have hit our commitment to recruit 26,000 additional staff a year ahead of the March 2024 target. We have also delivered on our manifesto commitment for 50 million more general practice appointments per year, with 367.7 million booked appointments across the past 12 months. Looking more closely at my right honourable friend for Witham's constituency, I'm pleased to say that there are now approximately 105 full-time equivalent clinical general practice workforce in the Witham constituency. This is an increase of 62% since September 2019, when there were about 65 full-time equivalent in the clinical workforce. In the east of England, there are now approximately 3,909 full-time equivalent GPs, and there were an estimated 3.7 million general practice appointments that took place in January 2024, with 72% of those face-to-face. In the Witham constituency specifically, 76% of appointments in January 2024 were face-to-face, up from 68.5% in January 2023. All the same, I commend my right honourable friend for Witham for her tenacious advocacy for a new health hub for Witham. The constituents of Witham are fortunate to have such a doughty champion with a deep and genuine care for their access to the health service. Mid and South Essex ICB have confirmed that GP practices in Witham are working together to help meet the health needs of local residents by sharing staff, teams and services. However, as my right honourable friend acknowledged in her speech, the financial complexities of bringing GP estates together can be multifaceted and challenging. Mid and South Essex ICB have confirmed that transitioning to a new building would involve complex considerations surrounding property ownership, leasing arrangements and financial investments. The ICB are also concerned that while Section 106 monies serve as a very valuable contribution to local NHS healthcare provision, the money available may fall short in sustaining the entire development of a new healthcare centre. So I do hope my right honourable friend and the ICB can continue to work together to think carefully through those challenges and find the best solution that meaningfully responds to the needs of Witham's patients. I also want to thank my right honourable friend for her comments about the future of St Peter's Hospital, a subject which I know is dear to the hearts of both my right honourable friends and is generating, as she said, an unprecedented reaction from her constituents. I will keep my comments on this brief, knowing the debate is going to take place on Thursday. This will be probably a longer opportunity for my right honourable friend, particularly my right honourable friend, the member for Malden, to build and expand on the concerns that my right honourable friend, the member for Witham, set out today. Let me be clear that no decision has yet been made about the future of St Peter's. Any decision regarding the future configuration of NHS services in Mid and South Essex should be made locally, following engagement with local communities. I am sure that local views are being listened to, and as my right honourable friend said, an NHS consultation is currently live, and I urge both right honourable members and their constituents to actively participate in it. I expect any subsequent decision taken by the local NHS to demonstrate improved outcomes for patients, having taken into account all the many issues that my right honourable friend has outlined today, and I'm sure will be further expanded upon on Thursday. I want to reassure my right honourable friends that considering in my own constituency an unpopular reorganisation of local health services in East Lancashire under the last Labour government in 2007, which removed a significant number of health services in my own constituency and transferred them to Blackburn, I'm very conscious of the potential impacts of hospital reorganisations, and I always look at these matters very closely and pay close attention to the views of local members of Parliament. Turning to the subject of urgent and emergency care, we absolutely recognise the pressures these services are facing, and we are working to ensure people get the care they need when they need it. While recognising there is more to do, we have seen performance improve this year. For example, at the Mid and South Essex NHS Foundation Trust, 67.3% of A&E patients were seen within 4 hours in January 2024. That's higher than the Trust performance in January 2023. At the East Suffolk and North Essex NHS Foundation Trust, 72.2% of A&E patients were seen within 4 hours in January 2024, higher than the national average. Ambulance handover delays, which have a big impact on response times, have reduced significantly this winter compared to last year. At the Mid and South Essex NHS Foundation Trust, delays of over 60 minutes have fallen by 48%. Nationally, we've seen progress on ambulance response times, with the average ambulance waits for Category 2 incidents down by over a third this winter. On the topic of dentists, which was also touched on by members today, we've heard today the continued difficulties that patients are having accessing a dentist. This is deeply unfortunate, and it's essential that we give patients the access to the dental care they rightly deserve. That is why we published our plan to recover and reform dentistry on the 7th of February to make dental services faster, simpler and fairer for patients. This will fund around 2.5 million additional appointments. Our plan to recover and reform NHS dentistry is backed by £200 million. Honourable members also mentioned the roles of and the important role of community pharmacy. Community pharmacies delivering healthcare make an extremely valuable contribution to our patients' lives. That is why we're continuing to support the sector financially, and we're providing over £2.6 billion every year to support community pharmacy. To go further, we're now investing up to £645 million across this and the next financial year in Pharmacy First, more blood pressure checks and more contraception consultations in pharmacy. Mr Henderson, please let me now address some of the concerns in the room regarding the Lampard inquiry, something of the utmost importance and sensitivity. I completely recognise the desire of families and other stakeholders that the terms of reference be finalised as soon as possible so that the inquiry can make progress with its investigations. Let me update my honourable and right honourable friends now on the most recent discussions. Following consultation with families and stakeholders, the Chair has shared her initial views on potential changes to the terms of reference. On the 5th of December, my right honourable friend, the Secretary of State for Health and Social Care, agreed to meet with families and local MPs in Essex to discuss the terms of reference. On the 6th of March, as referenced by my two right honourable friends, we met together, myself and the MPs, to discuss the inquiry. We agreed that my right honourable and honourable friends across Essex will put forward names for family members to attend a meeting with the Secretary of State so she could hear directly from the families herself. We have now identified a potential date for that meeting, and that will be communicated very shortly to MPs if it hasn't already been emailed out by my office. I do hope the meeting can take place on that date, and I hope that we can make the swift progress that we all want to see. Families have been waiting far too long, and I would again commend my honourable and right honourable friends for their work to shine a light on what has gone on here and ensure that the inquiry was established in the first place and finally is able to get on with its work and deliver the outcomes and the justice that the families all want to see. Let me wrap up, Mr Henderson, by addressing one of the most important elements when discussing the future of healthcare, that is prevention. I want to reiterate that the Government is committed to its levelling up mission to narrow the gap in healthy life expectancy by 2030 and increase healthy life expectancy by 5 years by 2035. To do this, we are tackling health inequalities through programmes such as the NHS's Core 20+5, which focuses on improving health outcomes for the poorest 20% of the population, as well as other groups. Furthermore, we will also publish a major conditions strategy this year. This is a direction-setting document which aims to pave the way for further action towards integrated care coordinated around the needs of people. This aims to improve healthy life expectancy, reduce pressures on the NHS, and reduce ill health-related labour market inactivity. These programmes will together help us shift the dial, both nationally and in Essex, on the NHS pressures in the future. Can I thank my honourable and right honourable friends for their contributions today, and can I once again thank my right honourable friend for securing the debate. I hope the answers have helped assure all those attending today that we are firmly committed to delivering for the health and wellbeing needs of the people of Essex and across the country.
Thank you, Minister. Dame Priti Patel to wind up.
Thank you, Mr Henderson. I'm particularly grateful for the opportunity to have the time today to discuss these health issues, important health issues across Essex. And I want to pay tribute to my honourable friends for Morden and for Colchester as well for joining this debate, and to the Minister for what, if I may say so, was a very, very concise summing up and a series of remarks, well-considered remarks. It's fair to say we've touched on a range of issues, Mr Henderson, the challenging demographics of the county of Essex, the needs of populations, important key areas covering primary care services, GP patient ratios, our hospitals, the need to safeguard the facilities of Morden St Peter's Hospital in particular, the need to secure a health centre in Witham Town, the growing needs in Tiptree itself, but also the significance of the demands on social care. And if I may, Mr Henderson, I do just want to thank everybody for their comments around the EPUT statutory mental health inquiry. This is particularly sensitive. It is very difficult and challenging. I do want to pay tribute to the Minister because he met with us last week and his comments about meeting with the families are absolutely crystal clear. I want to thank his office. His private office contacted us MPs today asking for the specifics that we have discussed, and that's in less than a week. So that's very important, and we will be able to go back to those families to give them, I think, the important information that a meeting with the Secretary of State will take place, and very soon. And my final comment really on that is to echo my right honourable friend, the member for Malden, in particular, that has been going on for too long. We need to find the right balance of redress as well, parity of esteem in the whole mental health debate, but also, while this inquiry takes place, the types of service and support that the families get, the lawyers get in particular. So, Mr Henderson, it's been a pleasure to be part of this debate, to secure this debate and raise these issues. And I just want to thank all honourable and right honourable members today for their important contributions. There's more to do, and we'll be back to discuss these issues again.
The question is that this House has considered health and wellbeing services in Essex. As many as are of that opinion say aye. Aye. To the contrary, no. I think the ayes have it. The ayes have it. Order, order. Will be suspended till 4 o'clock. Thank you.